Food safety experts say South Africa's deadly outbreak of listeriosis was inevitable. Early warning signs began showing up a few years ago when the NICD noticed a rapid increase in listeria cases.
It's a time bomb. It was inevitable that it was going to happen, that we would some or other time have a major outbreak. We were not ready for it. We didn't have our communication system in place.
But since government had not declared it a notifiable disease, the source was never investigated.
We noticed that since 2013, we see on average 60 to 80 listeria cases per year throughout the country, but that in 2017, the numbers dramatically started to increase.
In 15 months, at least 189 people have died and almost 1,000 have been infected. The death toll is expected to rise. Authorities cite the source of the outbreak as coming from tiger brands and from rainbow chicken.
What we have said is that there hasn't been a tangible link yet between our products and the illnesses or the deaths.
We reveal the results of independently conducted tests on locally produced and imported meat products from earlier this year and expose another potential source of the deadly foodborne disease. The Port of Durban in KwaZulu-Natal is one of the busiest on the African continent. Annually, thousands of tons of meat make their way through here. Brazil is the biggest global exporter of chicken and mechanically deboned meat. The pink slime, which is the main ingredient for South Africa's processed meat industry.
We'll do random sampling. We'll then decide, we'll take, one or two of those particular boxes, and then we open them, and then we take samples, in a hygienic environment, and we send those samples for laboratory analysis at our laboratories. Now, those will be tested for microbiological contamination or also for chemical residues. Thereafter, if everything is negative, then we release the consignment into the hands of the importer. And once it's released, it assumes the status of local meat because it complies, so the owner can then do anything that they like with that meat.
In August last year, Special Assignment traveled to Brazil to explore their food safety standards. This after a federal police investigation uncovered that health inspectors were paid bribes to allow the sales of contaminated meat for export. We then tested Brazilian chicken sold at Food Lovers Market.
The consumers must be seriously concerned because of the fact that these are microorganisms that they are consuming via this meat product. And these microorganisms are pathogenic. What do we mean by pathogenic? It means that they are able to cause diseases directly. These pathogens, they may be toxigenic. What do we mean by toxigenic? They are able to produce toxins. And some of these toxins are found to be cancer-causing.
In a written statement, the retailer said, "The chicken we tested is produced locally and was wrongfully packaged as a product of Brazil. This is a serious violation of the Consumer Protection Act, meant to ensure that South Africans know what they are buying."
This is the chicken that we tested in our last program, which contained high levels of bacteria, which is not fit for human consumption. So we're sending this back to the lab this time around, where they will test for listeria.
Food safety experts say defrosting and repackaging meat causes cross-contamination. It affects the product's safety and its quality. The South African Poultry Association wants imported poultry to be sold in its original packaging to ensure better quality control.
We have actually addressed this with the Department of Agriculture as well as the Department of Health. where we've asked if it isn't possible that the department insists on the product coming from whatever country that it comes from being packaged for specific South African purposes, so that when it comes here, it's already in a South African approved package that is therefore easily identifiable, and on that it would specify exactly what country it comes from.
We wanted to know from the Department of Agriculture, Forestry and Fisheries how the state of Brazilian meat imports is determined.
We did our own tests immediately when we got, hold of that scandal, when we knew about it. There were additional establishments that we had put on caution, and then it did additional tests. Now those tests, after a period of time, we analyze, the pattern. And when the pattern says this plant is clean, then you no longer then have to test it, at a scale where now it is a suspect case.
We then decided to send some mechanically deboned meat produced in Brazil to test for listeria and other foodborne diseases.
What happens is once the chicken is fully processed, all the cuts are taken out. The carcass of the chicken is then squeezed through a filter, and what comes out at the other end is this kind of pink slime that has been frozen, which is used in the manufacturing of bologna. South Africa does not manufacture MDM. It's mostly imported from Brazil.
SABCnews.com is your one-stop digital portal to all the news you need. With a website that is easy to use on mobile, SABC News prides itself in being the primary source of public service content across multiple platforms. Watch live streams of all the big news events on the SABC News YouTube channel, which is one of the most viewed South African YouTube channels globally. And catch up on the best of SABC television and radio news. Follow breaking news on all of the SABC News social media platforms, interact with SABC News on Facebook, and stay connected on Twitter for the latest headlines and real-time updates by our reporters. SABC News, everywhere.
In January this year, we exposed the unhygienic conditions of chicken sold at Food Lovers Market. Our investigation also found that consumers don't know the origins of imported chicken sold at retail stores.
This is very confusing for the South African consumer. If you look at this chicken, it says it's a product of Europe, Brazil and South Africa. So which one is it? The certification is on there, it's been passed.
In February, we took chicken pieces together with other meat samples produced locally and in Brazil to test for listeria. The test results on the mechanically deboned chicken tested positive for Listeria monocytogenes, the deadly foodborne disease that causes listeriosis. Listeria was also found in the frozen chicken. Additional tests on the MDM also confirmed E. coli.
The three most important foodborne pathogens being Listeria monocytogenes, the Salmonella, we have Escherichia coli. In the case of E. coli, they will also move through animal, through the gut of the animal, through a plant, a hamburger for instance, and then into the human illness.
From the date stamp, we estimate that this meat entered the country sometime last year. When it arrived at the port of entry, listeria testing was not a requirement, but the E. coli, a disease-causing pathogen, should not have been there.
Listeria was not mandatory, so before that, it was a microorganism of concern, but it wasn't routinely tested.
Klipspruit West in Soweto is a stone's throw from Kliptown. This is where the Freedom Charter was signed, a document that advocates equal rights for all. But more than 2 decades into democracy, South Africa remains one of the most unequal countries in the world.
Klipspruit West community is very well disadvantaged, unemployment and poverty.
A staple in poor communities is cheap, ready-to-eat processed foods like polony, Viennas and Russians. This is until an outbreak of listeria was discovered in polony.
Polony which is the source of the outbreak, is a cheap form of protein, right? So it's largely consumed in not the wealthiest part of South Africa. So what we've found is that the people that have been affected by the outbreak are people that are not necessarily wealthy.
On the 12th of January, after months of searching for the source of the outbreak, Mumi Olifant's creche provided some important leads when 9 children became sick.
Hilliard was weak, the dose was on oxygen. They then alerted us at the clinic that they'll be rushing them to Para. They put stickers on them and then they rushed them to Para. When we got there wasn't such a hiccup. We just got to the gate. They said the 9 children from the crèche. We said yes. We went to Ward 31. Got to Ward 31. The doctors were already standing there.
At the time, 61 people had died from the infection, with the death toll rising. But more than a month passed before the health minister announced that the source of the outbreak had been found. By then, at least 180 people were dead and almost 1,000 infected.
The environmental health practitioners were informed, and on the same day, they visited that crèche, which is situated in Soweto, and obtained samples from 2 unrelated polony brands manufactured by Enterprise and the Rainbow Chicken Limited, respectively, and submitted this to the laboratory for testing. Listeria monocytogenes was isolated from stool collected from one of the ill children.
After the discovery of listeriosis in one of the children at the creche in Klipspruit, Soweto, it took the department 6 weeks to make the announcement that the source of the outbreak had been found.
I do think that this is a time for us to reflect and look at where we are in terms of our capacity to manage outbreaks, because we can't prevent these. We will always have outbreaks. You know, the important thing is for us to be ready and to be well equipped to manage it when it happens. So I do feel like there were some gaps in the health system itself, but I also feel that we need to strengthen coordination between the different tiers of government.
According to the WHO, South Africa only has 1/3 of the recommended environmental health inspectors.
In terms of the new constitution from 1996, that function was taken from the Department of Health to municipalities. The function was given by the constitution to municipalities. And we have just realized that many municipalities don't really take that function seriously. Many of them are struggling to provide their basic functions like collecting refuse, making sure that there's clean running water.
Meanwhile, Tiger Brands, which the government has held largely responsible, questions the listeria test results and says there's no link yet between their ready-to-eat meats and the deaths of the people.
We will take full responsibility for our products, but we will take that responsibility based on tangible information that is provided to us. So what he was asking for was, let us wait and do the work and the studies and the investigations and draw conclusions based on data before we apportion blame.
To your team as well.
But who is to blame? The chairperson of Parliament's Portfolio Committee for Trade and Industry says they were shocked to learn that after 4 years of consulting, there was no oversight body for the processed meat industry because the industry could not agree on the high levies associated with this function.
My question was, how long, how many consultations do you need as government to say, we have consulted, but the risk now to people is so great that we must now impose this? There has to be a point in time where you don't wait and say we need to reach sufficient consensus, especially when lives are involved.
Professor Liz Corsten says the listeria outbreak was a tragedy waiting to happen. When it suddenly exploded late last year, authorities didn't know where to start looking.
We were caught off guard, and because we were working in silos and we were not communicating, and because we didn't have a common platform or a national single body that handles this, or even because we don't have adequate legislation covering the whole food system in South Africa, it just exploded.
Technology is used for both positive and negative.
Some governments block the internet in times of protest.
With this internet blackout, it's impossible for me to do it, so I have to travel to Douala.
This act is a true violation of the rights of citizens.
In Africa, people are always coming up with innovative ways to use technology to solve some of their problems.
The more interesting piece of technology is actually the artificial intelligence.
AI, it's utilizing data to make your life easier.
On Network, we give you Africa's technology and social media news.
Catch Network with Spumelele Zondi every Saturday at 8:30 p.m.
Corruption both in the public and the private sectors needs to be combated.
Where there are clear cases of wrong that has been done, that must commence immediately.
Something is being done about corruption in our country.
Currency, even although it's strengthened dramatically after the ANC's recent elective conference, could conceivably go stronger yet.
He had a soul that would not be for sale.
Stay tuned to Your World for your final news roundup, Monday to Sunday at 21:30.
Ephraim Shinula is assisting the families of the children at the creche who got sick after they ate contaminated polony. His grandson provided the crucial link to the outbreak when Listeria ST6 was found in his stool.
This is a questionnaire, Listeria Infection Class Action Litigation. This you can fill in at your own time. Basically, if there are any questions that you do not understand or don't know, just leave it blank.
Lawyers acting on behalf of the families recently launched court papers seeking compensation for the victims. The burden of proof rests in the Listeria outbreak strain.
This is not a criminal case, this is a civil case. So the standard of proof is much lower than it would be in a criminal case. So in a criminal case, you have to prove beyond reasonable doubt that someone has caused a specific problem. In the case of Tiger Brands, all we have to show is that given the fact that the people that were sampled they found the ST6 in them, and those very same people have given reports that they had consumed Tiger brand Polonies and Viennas, and even in those cases, some of those people did have those products in their fridges.
At the University of Pretoria, food safety experts have had a listeria research project in place for over a decade. Together with their international partners, they've tested the disease, which is prevalent in food, and have since broadened their scope to include testing polony for ST6, the deadly strain that has caused the deaths of so many people.
Those plates you are looking are growing media plates, the plates where we used to cultivate, identify and select different bacteria. In this case specifically it's for Listeria monocytogenes. Some components that are in the media we are able to identify if Listeria is present, Listeria monocytogenes is present in the samples. Those gray black colonies are an indicator of the presence of Listeria. That is the way the bacteria grow in this media.
From here, a separate process has to be undertaken. It's an expensive, intricate and complex test to establish the source of the outbreak.
It's very important that when you do tests like this, you must actually be able to link environmental isolates with a food product that was actually consumed and that actually caused the outbreak. So it's the three critical elements that you must link to prove it is that same organism.
The NICD says it has conclusive evidence that 91% of those infected with the bug tested positive for Listeria sequence 6, found at the Enterprise factory in Polokwane.
We then conduct the specialized genetic testing. It's a DNA fingerprinting called whole genome sequencing that allows us to compare the bacteria and ascertain with a great deal of precision whether they match exactly. So in that way we can be certain that we have an outbreak strain in patients that are being ill and then match it to a food or food environment isolate.
Other types of Listeria were also found in some of the dead and those infected. It led to the temporary closure of Sovereign Foods outside Pretoria and also the closure of the Rainbow chicken plant in Sasolburg. So what are the regulations for a bacterium that has caused so much destruction?
It's not mandatory necessarily and not for specific types of food. So there are recommended limits for certain types of food, and in some cases it will be a 0 limit or a less than 100 CFU per gram limit, or in the cases of some foods like raw chicken, there's no limit to the allowable numbers of Listeria that you can have.
The NICD says government needs to revise its legislation on food safety and quality controls. This is cold comfort for the families of the deceased.
Food safety regulation certainly does need some revision and updating, and this is already in progress. There have been in the last decade many new changes in international perspectives on food safety, and many countries worldwide have adapted their food legislations accordingly. So this does provide an opportunity and a very important impetus to change food safety legislation.
The class action lawsuit against Tiger Brands hinges to a large extent on the Consumer Protection Act, but attorneys say this doesn't mean that government doesn't have a case to answer for.
As much as Tiger Brands are to blame in terms of the Consumer Protection Act, but there's also a systematic problem here, because our understanding is that there is not, so the government is supposed to, I think they call medical practitioners, so people that are supposed to go to these factories and check that the products that are produced there are fit for purpose. There is that gap in the system. This is not to say that Tiger Brand is not liable, because they have a duty as a supplier to make sure that those goods that they supply are fit for purpose. But there is also a bigger picture outside Tiger Brand's liability, and I think this case shows that we need to look at those things a lot more seriously in order to avoid outbreaks of this nature in the future.
we have decided to take the products that we tested for listeria to be destroyed. The reason why we are doing this is because we kept the products that tested positive together, and in the advent that there could be cross-contamination, in the best interest of safety, these products should be destroyed. We drive to a landfill on the other side of town to dispose of our contaminated cargo. This dump site, the biggest in Johannesburg, is perched on a hill overlooking the city.
We got some meat here. We want to throw it at the landfill.
It's a meat?
Yeah. No, meat, yeah.
Oh, we don't take it.
We eventually find an incineration plant that will take our meat. In so doing, we've ensured that it doesn't get into the wrong hands. As we look on, we spare thought for the dead and those infected with a disease that has caused so much harm and could have been prevented.
There might be some compensation for pain and suffering. You look around yourself in your community, in the places where we buy our food, and believe you me, from my layman's perspective, it's not up to standard at all. We need to up our game. We need to up this to a level that this should not happen again.